If you live with chronic pain or fibromyalgia, you already know the flare-ups, the fatigue, the days your whole body just aches. But here's a question I ask my patients that surprises them. Could part of it be on your plate? I'm Dr. Guiang, and I lead the Regenerative Medicine program at University Pain Consultants. Today, I'll walk you through the 3 foods most credibly linked to chronic inflammation and how that inflammation connects to your pain. Here's the connection. Certain foods can nudge your body into a low, steady state of inflammation, measurable in markers like C-reactive protein. In conditions like fibromyalgia, that background inflammation can turn up the volume on your nervous system, making you more sensitive to pain. Now, food is not the whole story, and no single meal is the cause. But for many of my patients, adjusting a few things makes a real difference. Let's start with number 1. Number 1, added sugar and refined carbohydrates. The biggest offenders come in liquid form: regular soda, sweetened iced teas, energy and sports drinks, and fruit juice cocktails. A lot of these are sweetened with high fructose corn syrup, a cheap sweetener that hides in far more than soda. Start reading labels and you'll find it in ketchup and barbecue sauce, salad dressings, pancake syrup, flavored yogurts, granola bars, breakfast cereals, canned fruit, and even a lot of packaged bread. Here's why fructose matters. Your liver has to process it, and that can push up uric acid, which is itself tied to inflammation and gout. Then there are the refined starches: white bread, white rice, regular pasta, bagels, crackers, pastries, and donuts. These spike your blood sugar, drive up inflammatory markers like C-reactive protein, and form compounds called advanced glycation end products, or AGEs. For someone already fighting chronic pain, that's fuel on the fire, and this is the one I'd start cutting first. Number 2, gluten, the protein in wheat, barley, and rye. It's in the obvious foods: bread, pasta, pizza dough, flour tortillas, crackers, most baked goods, and even beer. But it also hides where you wouldn't expect it: soy sauce, many soups and gravies, salad dressings, and some processed and deli meats. I want to be precise here because this one is individual. Beyond celiac disease, there's a condition called non-celiac gluten sensitivity, and research has connected it to fibromyalgia. In several studies, fibromyalgia patients who removed gluten reported real improvements: less widespread pain, better quality of life, and in some cases, striking symptom relief. Not everyone is gluten sensitive, so this isn't a rule for all of us. But if you have fibromyalgia or stubborn chronic pain, a supervised gluten-free trial is a reasonable experiment worth discussing with your physician. Number 3, ultra-processed foods. These are the packaged, ready-to-eat products built from industrial ingredients and additives. Think packaged chips, cookies, and candy, sugary breakfast cereals, instant noodles, and boxed frozen dinners, fast food, and processed meats like hot dogs, bacon, sausage, and deli lunch meat. This is where the strongest recent evidence is pointing. Large studies tie higher ultra-processed food intake to elevated inflammatory markers and even a greater risk of inflammatory conditions like rheumatoid arthritis. And here's the honest part: it's usually the whole package: the refined starches, the added sugars, the industrial additives, not one villain ingredient. Cooking more real, whole foods is one of the most powerful anti-inflammatory moves you can make. So what do you do with this? You don't need a perfect diet overnight. Start by cutting back on sugary drinks, leaning into whole foods, and paying attention to how your body responds. And because pain is complex, diet works best as part of a bigger plan. At our clinic, we combine nutrition guidance with physician-led regenerative and non-opioid pain therapies built around you. If chronic pain or fibromyalgia is running your life, let's build a plan that addresses the whole picture, including what's on your plate. We have offices in Menifee and Riverside right here in the Inland Empire. Visit the link in our description or call 951-900-3253 to book a consultation. One important note: this video is for general education only and is not medical advice. Diet affects everyone differently, individual results vary, and you should talk with your own physician before making major dietary changes, especially if you have a medical condition. Thanks for watching, and I hope to see you soon.